out of range. Oh, video, we don't care about that. I'm so pleased to be here, and I'm so pleased to be a recipient of this award. I was lucky enough to know Matilda Riley, unlike Kevin, and there are three things that she really, I think, influenced me on. The first is, of course, she was a woman who did her research and moved to different organizations, continued on her path at what she thought was important. The second is that she gave back to science, and that's what she did here when she came to NIH. And that is when I knew her at that point. And I think that's something, I'm a life course developmental psychologist, so I think about life course, and that's something all of us can think about. You know, there are other ways to contribute to science besides being a scientist. And the third is she came to NIH when she was my age. So I've thought a lot about that and what my next 20 years bring. Again, I am a lifespan developmental psychologist. So I'm just so pleased to have gotten this award. What I'm going to do is give a whirlwind view through some of the developmental research that I do. And I've entitled this The Long Reach of Early Childhood. And I want to talk about biological and environmental influences. It's really unbelievable to me, being a life course person, how rapidly, in looking at the life course, biology and actual measures of biology have been brought into the research that we do. So I'm really lucky to be doing research at this time when all these things have been brought in. In the olden days, we talked about the temperament of the child, and we did that by asking questions about a child's temperament. Now we have biological measures. So the world has changed so fantastically, and I'm so glad that I happen to be doing research at this time. What I look at, what I'm interested in, are well-being and disparities in well-being. When we look at childhood, I'm looking at cognition and schooling, behavioral regulation, and physical health. We are interested in adulthood outcomes. So of course, the three that are related to the first three are earnings and education, crime and mental health, morbidity and mortality. I'm particularly interested in the first 8 years of life, and I'm interested in the fact that we see huge disparities in how children are faring by age 3, 4, and 5. I'm not going to show you a lot of data on this, but the differences between poor and non-poor children are very striking. And in fact, the disparities as a function of social class are now larger than the disparities you see at age 5 by race. So I think I'm very concerned about racial disparities as well, but it's important to realize that socioeconomic status in terms of how kids enter school and what's happening to kids over their life phase, at the moment, social class is trumping race. Quite remarkable. I look at childhood adversities in capital, and I look at low family income, low parental education, and I also look at economic conditions. We've done some work on the Great Recession. I'm going to present a couple slides on that. You guys can read what we look at, people like me, in terms of low family income. Typically, we're talking about poverty in the bottom quartile of the income distribution, and then near poor, it actually should be quintile, is the second to bottom quintile of the income distribution. What we really are finding today in general is that if we're worried about income, we really are talking about income for the bottom 40%. I'm not talking about 5%. What you're really seeing is that there is, the bottom 40% are being left behind. This is in terms of cognitive disparities and academic disparities. And the top 20% are taking off. We have bigger disparities today than we did 40 years ago. I look at family life adversities, and I've just listed some of these here that people like me look at. We look at harsh and disengaged parenting. We look at the emotional health of parents, think primarily of anxiety and depression. We think about cognitive stimulating experiences. I'm thinking more and more about violence that children are experiencing or witnessing in their lives, and also what I call household turbulence, which really has to do with conflict, frequent moving in and out of households, and what some people would just call chaos. The best measure of chaos that I've ever heard is and all of us probably have felt this, you know, there's so much going on, I can't think. That's my measure of chaos for myself. I also look at neighborhood. I'm not going to talk about neighborhood today, but I've done a lot of research on neighborhood, and I just wanted to list some of the aspects of neighborhoods that people like me look at, trying to understand how children fare in the world. And these are some of them. We can talk about them later. There are 2 or 3 models that have basically propelled the research and the interventions that have been done with young children. The first is the human capital model. Here you're looking at low income and low maternal, primarily education. And you're looking at how these relate to talking, reacting, and being sensitive to children, and the provision of stimulating materials. All of these are believed to influence achievement. These are the kinds of measures I would look at to make the point that I can show differences as a function of social class, income, and education on 3-year-olds' cognitive functioning, and actually probably 2-year-olds as well. They tend to be through these 3 pathways. Here's just one example. You've probably heard Hillary Clinton talk about the 30 million word gap. She is doing a lot on what she calls too small to fail. I think it's a great title. But here's the data she's basing that on. This is a study where audio tapes were taken in homes of a very small number of kids. And people have looked at the cumulative vocabulary, what kids would hear over time, and you can see the differences by education here. Family stress model is the second model that people like me look at. Here we're typically looking at low income, not low parental education. And the 2 pathways through which this works would be parental depression and anxiety, as well as harsh parenting. Here the outcome typically is behavioral dysregulation, think aggression, think attention disorders, things that are related to school achievement. In our work, we're bringing more family adversities into our models. This just shows some of the ones that we would put in. These tend to operate by affecting parenting, specifically harsh parenting, which then would be related to mental health. And think, again, aggression, attention, and perhaps anxiety, what I call the 3 A's. Now, for people like me who try to study childhood adversity and what happens to children, there are just a few ways that we think about this in terms of theory and ways of testing our models. The first is to really understand our upstream correlates and conditions. The second has to do with continuity and timing, and this is the hardest one, and this really is related to when we decide to intervene with kids. The problem is people often say early childhood is very important, which I believe is true. The problem is that if a family is poor in the first 3 to 4 years, they are probably poor in the next series of years as well. This is also true for harsh parenting. If I have a parent who's being harsh very early, very likely that parent continues to be harsh. So can I separate out when it occurs from the continuity? And that's really important if you're trying to figure out when to intervene and what you want to intervene on, besides being important theoretically. We also look at reciprocal effects. People like me have thought a lot about, is there a heightened salience to certain childhood adversities at various ages? This kind of goes back to the timing issue, but it's very important. A lot of work has been done on puberty, not on the first 5 years of life, suggesting puberty may be a time where children, youth, are particularly influenced by negative conditions. We consider cumulative risk, co-occurrence of risk, and then I look at biological processes as markers and as moderators. I'm going to present some data from fragile families talking about all of these issues. This study, funded by NICHD, is a birth cohort that's been followed through age 9, and we are in the field at 15 as we speak. We have 20 U.S. cities, almost 5,000 families, 75 hospitals. We oversampled non-marital births because non-marital births we consider fragile families, hence the title. This study will probably never be replicated because we had to get IRB, separate and different IRB approval from each hospital, which was a nightmare. This study is representative when you weight it up for the demographers and epidemiologists in the room to cities with populations of 200,000 or more. This is the timeline when we were in the field, and as I said, these are the times we saw our families. Unlike any other study that's been done, we interviewed the mothers and the fathers at all of these ages. How did we get the fathers? It's really hard to get fathers in studies. We got them when they were at the hospital. So our baseline was done at the hospital. Whether you're married or not and you're a father, you go to the hospital in most cases to see the baby. So we have the best data, actually, probably internationally, on fathers' contribution to children. We ask a lot of different things. We talk to the child, we talk to the mother, we talk to the father, we go into the home, and we collected DNA data at age 9 and are collecting it at age 15. Why did we look at unmarried women? Because we have lots of births to unmarried mothers. It's over 40% for the total sample right now. For births to women under 30, it is over 50%. There are racial disparities, but it's high for all groups. And this was my point earlier that things have changed over time. If we look at low, middle, and high education and the percentage of unmarried mothers, you can see that it's really skyrocketed for the low education group. Unmarried motherhood is still relatively uncommon for high education mothers. From our sample, 50% of our unmarried parents were cohabiting at the time of the birth. Only 9% had little or no contact with the children, which I think the fathers having little or no contact. The unmarried fathers' capabilities at birth were vastly different from married parents. You guys know this from the media, but there are a few things that I think are important here. Poverty is hugely different. The education is totally different. And what's very important and shocking to me, even running this study, is that our unmarried fathers are more likely to have been incarcerated. In our sample, it's 40% have been incarcerated by the time the babies were age 9. That's a lot of incarceration. And again, I personally was shocked by this number. I would have predicted if, I don't know if you guys do this in your teams, but we have bets and then people have to buy, wine and dinner when you lose the bet. Oh, it's really a fun way to do research. Anyway, I would have predicted 15% would have been incarcerated. I would have been really wrong. The sample in terms of ethnicity, it's about 40% Hispanic, 35%, 30% black, and the rest are white, very few Asians. What's the story about turbulence? The story is that these unmarried families, the kids, think now you're the child being born into this family, you're very likely to have your parents break up by the time that you are 5 years of age. This, for some reason, is all messed up, but just ignore the fact that it's messed up. I don't know why it's messed up. But what you see there is about 60% of the unmarried births the parents had broken up by the time the kids were 5. This just gives a little example of the number of transitions that have occurred. Just look at the unmarried mothers. I think that's the most important. We're thinking, again, of the number of transitions that these kids have experienced by age 5. And what you see is a huge, huge number of transitions for the unmarried mothers or the kids by the time the kids are 5. So what you're seeing is not just are they unmarried, but basically fathers are moving in and out of the house. And so what you see is a lot of turbulence. And one question we have is it the turbulence or is it being unmarried that makes a difference, right? Because people have always said it was being unmarried. It could be the instability in the family. Here what we've done is just put together the family type and the instability. And you can see that you have complex families and unstable. This is going through age 5 again, about 77%, very high. By age 5, our unmarried kids to unmarried kids have lower scores on cognitive tests, more mental health problems, more physical health problems, specifically asthma and obesity. And this is net of all the differences in resources at birth. This is controlling for everything that we can control for. We do find that the more instability, the more likely that there are problems for our children. I want to turn briefly to talk about harsh parenting for a moment, because that's a family adversity that we've done a lot of work on. This is looking at the percentage of children who had harsh parenting at different ages. Any spanking, that would be 40% for the first white bar at 1 year of age were spanked. That's a pretty high percentage of kids that are spanked. And notice by 3 to 5, it goes up to 65 to 70% of all these kids have been spanked. We also were interested in high-frequency spanking. That's less likely, but you can see that it's about 10%. And then it goes down by age 9 years. There are lots of correlates of harsh parenting, which I won't go into here, but they're the ones that you would expect. Boys are more likely to have harsh parenting. Parents who are stressed, smoking and drinking during pregnancy, prenatal violence toward the mother, late prenatal care. Again, I don't think this is particularly surprising. Here, what we've done is looked at cumulative risks, going back to some of the risks that are listed here. And what we're doing is looking at externalizing problems. And you are looking at kids with low, medium, and high cumulative risk. And what isn't shown here, which I don't understand because it was, but that's life. Here you're looking at kids who were spanked at 3 waves of the data. These are kids who were never spanked, but they had cumulative risks. And then these are kids that were spanked in 1 to 2 of the waves. What you find is that for the kids who were spanked 3 or more times and had high cumulative risk scores, their mean externalizing scores were about 20. 20 means that they're in the clinical range of aggression. They're incredibly high. I've never seen a mean score that high in any of the work I've ever done looking at aggression. And I think this is really important. I'm going to skip that. We also have looked, when we look at the low spanking, high spanking, cumulative risk, not cumulative risk, by the genetic alleles that the children have. And what we have here is a dopamine allele on the DRD2 gene. And what I want you to look at here is the early harsh parenting kids that had high cumulative risk. If those kids had what we call the sensitive allele from this dopamine gene, again, their scores are almost 17. So what you see here is a beautiful 3-way interaction. looking at early harsh parenting, cumulative risk, and then looking at genotype to understand that some kids are more sensitive to this harsh parenting than are others. And this is the kind of work that, again, in the past we would have looked at temperamental differences, but now we are able to actually look at genetic sensitivity. Okay, is that clear? We've done quite a bit of work. I'm only presenting 3 examples of some of our gene by environment interaction. I like this one particularly because it is a 3-way interaction, and it is looking at early harsh parenting, since I'm so interested in the issues of timing. My next example from biology is telomeres as a marker of stress. In our 9-year-olds, we have analyzed the telomere data, and I'm going to talk about telomere length here for a few minutes. This is what we have done. The first paper that we published off of our telomere length data came out in PNAS. It is only on 40 boys. They were African American boys who are 9 years of age. That's when we collected the telomere data. The shortening of telomere is considered by many to be a marker of stress. There's a very interesting issue about whether you can reverse this, if telomeres can be lengthened. I think the jury is still out on that. Interestingly, Richard Sussman before he passed away, had put together a reversibility network, I am part of that, which is asking those questions. Can you actually put interventions in place that can reverse some of the damage that's been done? And one thing we will be looking at is telomere length between age 9 and age 15, because we'll have the data at age 15. What we found in this, we looked at 4 different harsh family conditions, which I'm going to show you in a minute. What we found is telomere length was shorter for the boys in the harsh family conditions, which is probably not so surprising, except we only had 40 kids, which is not that many kids. It also turns out it is shorter for the boys in the harsh family conditions if they had the sensitive alleles for dopamine and serotonin present. So what you got here, which I don't think anyone else has shown, is an interaction predicting telomere length is now the outcome measure. I'll just show you, we had 4 different variables that we put in our harsh environment measure: mom's education, family structure, my harsh parenting index, which did nothing here. That was very upsetting to me, but that was 40 kids. We'll see. Now we have the data on 2,000 kids, so we're about to do more data. And then average income to needs. Everything worked the way you would have expected, that these negative events were related to shorter telomere length. This is the interaction that I found so interesting. We've looked really at serotonin and dopamine somewhat separately. We've looked at advantaged and disadvantaged kids, dividing them into 2 groups, again, of only 20 each, and then looked at how many sensitive gene alleles they had in the serotonin system that we were looking at and the dopamine systems that we were looking at. And what you're seeing here is some evidence that when you have sensitive genes and you are more disadvantaged, you have lower telomere length. Look at the up. And what's also interesting is there's a little hint that if you are in an advantaged environment and you have the sensitizing genotypes or gene alleles, you actually have longer telomere length. So people have been talking a lot about genetic differential sensitivity, which would suggest that kids with particular sensitive gene allele patterns will do worse in bad environments, but better in good environments. This is just a little example of that, and we will be looking at that more. We also have just finished some analyses because we have a bigger sample now, with children from Latina mothers. 2/3 of these moms were born in the United States and 1/3 were not. And we're really interested in the immigrant health advantage that people have been talking about with other measures, not telomere. And here what we're finding is native-born mother kid, these are the 9-year-old kids, right? But of the native-born mother had the shortest telomere length. The mothers who came to this country prior to the child's birth had longer telomere lengths, and it didn't matter when the mother came. We controlled for about 50 different variables, so I think this is true. This is probably the first example of, if you will, the immigrant advantage, but using a measure, a biological measure like telomere length. Typically, people have looked at other kinds of measures to suggest there is an immigrant advantage. My next example really has to do with parenting and related to the Great Recession. We're still, I should say, trying to understand what is different in the lives of the kids whose mothers were native born and the kids who weren't, especially given that we controlled for 50 different things. There has to be something going on. Of course, it could be prenatal, it could be food, it could be breastfeeding, but we controlled for all that, but we're still trying to understand what's going on. Let me turn to the depression. What we have, Great Recession, sorry, it wasn't a depression, except it really was. We happened to be in the field at age 9 when the Great Recession happened. What I've done here is the red bars show you when we were in the field, okay? And then we have 3 measures of the Great Recession that we have up there. I'm going to tell you what the CSI is in a moment. You see that peaks during January. If you remember, that's when Bear Stearns and people went under, and people were worried that fall, what was going to happen to our whole economic system. Then I've also put unemployment rate and foreclosure rate, so you can see how those work. What you do see is that the CSI, which is a consumer confidence measure, it actually kind of relates to Kevin's work in terms of people's uncertainty about the future. It actually is very useful from a behavioral economics measure. It leads unemployment rate by about 3 to 6 months. And then you notice the concern about the economic uncertainty dropped even while our unemployment rate continued to go up. So our group has been really interested in understanding what happens during a recession or depression in terms of parenting and child outcomes. I'm not going to present child outcome data. This is this consumer sentiment measure, because you guys probably don't know what this is. It's collected every month by a telephone survey. It asks about economic uncertainty in the world as well as in your own life, okay? It's normalized to have a value of 100. We reverse coded it, so a high CSI is bad. It means there's a lot of uncertainty. Given that we were in the field all this time, we are able to attach to when each mother and child were interviewed at age 9, the actual CSI rate, unemployment rate, and foreclosure rate at the time of being interviewed. Got it? Right, because we were seeing people all during that. Then we use a lot of fixed effects models and controls for cities. Our cities differed in terms of the unemployment rate. Detroit was in our sample. It obviously, the unemployment rate was much higher for Detroit than some of our other cities, but we control for all of that, of course. It is important that the CSI is national. I can't do that at the city level because they don't ask enough people. but it's a really interesting measure. And just to cut to the chase, we're looking at high rates of spanking and risk for child maltreatment. Remember, the CSI goes up. That means economic uncertainty and concern is higher. And what you see is an increase in severe spanking as the CSI got worse. We found this even controlling for what the mothers were doing at age 5, which makes it even stronger finding. And we also controlled for the unemployment rate. It wasn't the unemployment rate, it was economic uncertainty. We've also controlled for whether the mother herself was unemployed or the father, and it wasn't that. So when people are uncertain, and again, I don't think anyone has shown this before, people have more harsh parenting. Now, it also turns out they spend more time with their kids. So you can't decide, are they doing more harsh parenting because they're spending more time with their kids? You can make a lot of arguments. But what I want to show you for the biological piece of what we did, we also here we're looking at dopamine, and we were looking at whether or not mothers, this is mother's genetic sensitivity, not the child's, whether the mothers who had the sensitive alleles on, in this case DRD2, showed more of an effect as a function of the recession. And what you see here is that our mothers with the more sensitive alleles were the ones who showed the big uptick, right, at the time of the very beginning of the Great Recession, when you saw the CSI take off through the roof. So here's another example of a biological by environmental interaction. A lot of economists like this finding because the environment is, if you will, exogenous to the family itself, i.e. the family did not cause the Great Recession, and you can't say that the causality is reversed. So this article came out in PNAS about 2 years ago, and as an example, again, of the kind of work we're trying to do, putting together biology and environment in the Fragile Families study. We actually found effects on kids too, but just to let you know, there were effects of the CSI on children, but only on the boys. And we got that in terms of the mothers reporting on the kids' behavior and the kids reporting on their own drug use and vandalism. And we have not done the genetic interactions yet on that sample. Now, I want to just end talking a little bit on where we really might want to intervene, because part of my life is spent running interventions and evaluating interventions. From the research that I've presented, there are 3 big categories for looking at intervention. The first would be human and economic capital. In this case, we could intervene on family income. We could intervene on parental education. I could change neighborhood conditions. Or in the case of the Great Recession, I could buffer the country in terms of national economic downturns like the one we just had. In terms of family life, since harsh parenting seems to be very important, as does parents' emotional health, which I have not talked about today, but the data are quite convincing. Stimulating activities and materials, talking to children. So I could intervene on those types of variables. And then finally, I could intervene for the child. And this could be in terms of achievement and cognition, and in terms of behavioral dysregulation. And Erica, you should tell me how our time is going, because I can talk a little bit about these or just leave it here. Okay. Okay. Because there is a huge, I could have done a whole lecture on, given what we've learned, and what interventions have we tried and what ones have worked. Family income, there is data suggesting, but it's not experimental, that kids' outcomes are affected a little bit by about $3,000 to $4,000 of extra money. This would be for low-income families. And so now the question is, if we did a randomized trial giving families money, would we get the same effects that we see in the longitudinal data? And a study is being started by my colleague Greg Duncan to look at this issue. We are doing some work with subsidized housing in New York City. I'm in 16 buildings, and this is for not poor families, but families who are near poor. Well, they're between 20% and 50% of the income distribution. New York City, because it's so expensive, families in that part spend much more than 30% of their income on rent, which is more than people have deemed is a good measure, amount to spend. In any case, we have lotteries in New York for these buildings because they're subsidized heavily. And we probably have, at this point, 40 families applying for every one that gets in, showing there's a huge demand. In any case, we are in 16 buildings. There are 16 separate lotteries. And in fact, by heavily subsidizing the rent, you actually are giving people income. And you're giving them about $6,000 a year. This is particularly interesting because these families are all working. These are not poor families. This is not public housing. So we're looking at family income in a slightly different way to understand when you get into the subsidized housing and your rent drops and your income increases, what happens to children, what happens to families. The one thing I can say is the parental stress drops tremendously and the harsh parenting drops. And we still haven't, we're still in the field, so I can't talk yet about what we're finding on the actual expenditures on children. So that's one pathway. And we don't have enough experimental data to see if our longitudinal data are right. The second has to do with parental education. There's some suggestion from the longitudinal data that parental education matters. It matters actually more than family income. So we have a trial going on in Tulsa, Oklahoma, where we are offering incentives and coaches to help mothers whose kids are already in Head Start to go back and get either education, or what we're really trying to do is get them into jobs. So we are training these mothers for CNAs and IT in the health sector. We're dealing with the health sector. And our theory is, one, it makes me think of Kevin, because without the incentives, I'm not sure this would work, because it adds a lot of stress if you're a poor mother and you're expecting them to go to school and work, because all these mothers are working. So anyway, we're trying to see on the child side, we've shown that a huge percentage of our moms are finishing one of the programs and getting a job in the health sector, which is great. And now we want to see, is that going to affect the kids, right? Because that's, many of the earlier parental education trials that were done 10 years ago showed very few effects on the parents and very few effects on the kids. But we've made, we've kept 90% of our families stay in these programs, which is huge. So if we don't get effects on the kids, actually it's going to be fairly upsetting in terms of what we believe about can you change parental education and change parenting behavior. Family life, a lot of interventions on home visiting, trying to alter harsh parenting, trying to reduce parents' depression and trying to do more on stimulating activities. My read of the evidence, again, some of the work I've done and some of the work a lot of people have done, is that our home visiting programs are pretty effective at reducing harsh parenting. They are somewhat effective on changing what parents do with kids, but less effective than we'd like. And I think the jury is out on depression, mother's depression. So we can make effects on harsh parenting and stimulating activities. Interestingly, though, these home visiting programs, the vast majorities don't show effects on the kids. So the question is it because you need a bigger effect on harsh parenting to get an effect on the kids? Or is there something else that we ought to try to be doing in home visiting programs if we want to affect the kids? Some people in the field won't agree with me on how I read the home visiting literature. I've written a couple of reviews and done a couple of them myself. So I think the jury is out. Third, really, are programs that directly target the kid. These are early education programs. These programs can be incredibly effective in altering kids' trajectories in terms of school. New programs are focusing specifically on behavioral dysregulation. These are fairly new, but the few programs we have are showing big effects. The problem with our preschool education programs is that a lot of these effects, while they're pretty big right at age 5 or 6, they still can be seen at age 10, but they fade out by age 18. And so a lot of us are really focusing on which programs are the ones that are likely to actually show sustained effects for children through age 18 and into adulthood, and which ones will not. And I'm going to leave right there. Thank you.